Growing up, I was raised by my father. He was a single father, and my dad was an alcoholic. It was a pretty volatile household as an adult. I was in a relationship. I got married, and I was not using at the time, but my husband was, and I separated from him, and he kept using and broke into my house one night in the middle of the night. And even though he had never been physically violent with me at that point, that day he was. And I have no memory of the event, but I was in a coma for about a week. I was in the hospital for a month. And obviously I had depression and PTSD and anxiety, and I couldn't sleep. And everything that was wrong with me when I left the hospital, I was given a pill for. I had a lot of surgeries, facial surgeries following that from the attack. And so just being prescribed those medications with no education about it, and being that I feel addiction, the disease of addiction, is a progressive disease, that's exactly what happened to me. When I found out I was pregnant, I was on a high dose of methadone and knew right away that I was not going to stay on methadone, and I was using other substances as well. So I checked myself into detox. From there, I went directly to a long-term treatment center. However, I got out 2 or 3 weeks before I gave birth, and unfortunately, I used as soon as I got out. So the last 3 weeks of my pregnancy, I was using. So I was induced early because, I'm sure of my using. And I remember one of the nurses coming in, and it was a general question. She said, "Are there any medications that you're on that you need to let us know about?" And knowing now, it was just a general question, but in that moment, I broke down and hysterically started crying and said, "I relapsed 2 weeks ago. What is going to happen to me? Is DCF going to come? Are they going to take my baby? Am I going to be okay? Is my baby going to be okay?" And she was so kind. And I remember her saying, "Your blood work came back and you tested negative for everything." However, knowing, that they are mandated reporters, DCF did come. And when she came in, she came in on her day off to see me and check on me. And the whole time she was just so reassuring, like, "This is gonna be okay. You were clean for most of your pregnancy, and this, we've been through this before. We're gonna be here for you." And then when Dr. Carbiner came in, just the love and compassion. And even though I had used those last 2 weeks of my pregnancy, she focused on the 8 months that I didn't use. They sat down and they moved in closer to me, and they held my hand and looked me in my eyes, and they said, "You are a good person. We can get through this. We know what a solution is. We're here to help you. You are a good mom." Just simple human connection and compassion, and made me feel that even though I didn't feel those things at that time, they believed in me until I was able to believe in myself. And it just made such a world of difference for me. And without them, I don't believe that I would have went back into treatment at that point. I wasn't aware until recently that the #1 cause of death for pregnant women and mothers is overdose. And I think that sending those mothers home from the hospital with those Narcan kits, with the education of it, and the education to their families as well, will make such a huge difference. All 3 of my overdoses were in a 5-week period. The first time that I overdosed, I don't remember much. The paramedics had to give me Narcan 3 times to bring me back. And the second time that I overdosed, I had someone else that I was using with who knew that I had recently relapsed. And so when she came to meet me to bring me the drugs, she also brought Narcan. And thank God that she did that, because I again overdosed, and the Narcan that she gave me did work. And by the time the paramedics got there, I was so fearful that I was going to get in trouble and caught with the drugs that I refused treatment and walked away. The last time that I overdosed was the same person that saved me the second time. She did not have Narcan, and 911 was called. The paramedics came, and I don't remember how many doses of Narcan I had to get that time. I know it was more than 1, and I was taken to the hospital, and the overdose was so severe that time that I had to stay there for 24 hours to be monitored. So what I would like doctors and nurses to know about women like me is the importance of having naloxone readily available. Not only has it saved myself, it was given to me at an event, and I came back home and distributed it amongst my friends. And several weeks later, I was at a store, and I noticed a crowd around a car, and nobody knew what was happening. And I was able to see and realize that this person was overdosing. And I had naloxone in my car, and I was able to save that person. I think it's so important for it to be, readily available, not just to medical professionals, but to just the community in general. It saved my life, and my story didn't end the way that my daughter's father did. My oldest daughter's father passed away from a drug overdose when she was 4. His story ended. The legacy that he's left for his children was that he died from an overdose. I am so grateful that that is not my story. If it wasn't for Narcan, that would have been my story. And both of my children would be orphans with no parents who both died from a drug overdose. But because of Narcan, I was given more than a second chance and the ability to turn my life around. I had an addiction, I have an addiction, and I've worked through that. And through that process, I am a present mother today. I am a daughter, an aunt, a friend, and another woman in recovery, able to help women in the same situation that I was in. I can't stress the importance enough of Narcan. I think that it's so imperative, especially because of the impact that I know nurses and doctors and caseworkers made in my life. My life is so full today. If I think about it too much, I will be brought to tears, because never in my wildest dreams, after 15 years of active addiction, did I think that I would be clean and be a productive member of society, to be such a present mother. As a result of my recovery, my entire family has healed. I volunteer time in our community. I feel healed and pure and full of optimism. And I know that each day that I continue to stay clean and work a program of recovery, there's just more possibilities that present themselves.